Well, right now, the big story, of course, is the Ebola crisis and the steps that hospitals across the country are taking to try to get ready.
That's right. Our local hospital, Conemaugh Memorial Medical Center, is having some type of drill later this morning. Our Kerri Corrado is live at the hospital where the drill will be taking place in just a bit. Kerri, good morning.
Morning, Kerri.
Good morning, Lindsay. That drill is going to be from 7 o'clock to 8 o'clock, and most of it's going to take part inside of the hospital, but there will be a yellow decontamination tent right out in the parking lot. So if you're passing by and you see it, do not be alarmed. This is all for training purposes in case an Ebola patient ever came to our area.
It's just a good way to get everybody up to speed, keep everybody practicing, because hopefully we'll never need to do this. But the more you practice, the better at it you'd be.
Too much practice, never a bad thing, especially when it comes to treating Ebola. That's the mindset of those working at Conemaugh Memorial Medical Center.
People most concerned are the ones in healthcare, because if someone does have symptoms, they're going to come here.
Rounding up their troops to learn how to tackle and treat the deadly virus.
What we've been emphasizing is emergency room staff and ICU staff as far as training and drills. Just because if they're sick, they would come in through the emergency room.
Dr. Harold Ashcraft says his team has been constantly updating themselves as the virus develops and following CDC protocol.
They are right on top of this. I mean, daily there's new information coming out from the CDC and the Pennsylvania Department of Health. So what I keep hearing from them is don't panic. This is a very unlikely scenario in this region.
It was only a short while ago a Texas nurse contracted Ebola while treating Thomas Eric Duncan, who was the first patient who died in the United States. This drill will help staff run through every scenario possible, treating the patient carefully so something like that doesn't happen here.
They have to know what equipment to use, what protocols to follow. And in fact, we've been having drills where our hospital staff put on the protective clothing.
I think all of us in healthcare and just the community in general are very hopeful that, that there'll be a silver lining in this, and that might be that someday there's a vaccine for Ebola or certainly a treatment.
Now, this drill will not interrupt any patients or the daily routine of the hospital, but hospital officials say they feel they are in good shape here.
Kerri, just to remind everyone, Memorial Medical Center isn't the only one preparing themselves for the Ebola crisis, right?
Right. Hospitals all over the United States are working hand in hand with the CDC to make sure they're, paying attention to the protocol and keeping up with those updates. We have to remember they use the example of the nurse who contracted Ebola from treating the patient in Texas. So the big thing here is to not only treat that patient, but to make sure the staff is safe.
All right, Kerri, thank you.
All right, thank you, Kerri.